As a nurse in the ED, we can easily be pulled in many directions at the same time in order to take care of multiple patients. Last year, I had a male patient with acute leukemia who had presented with fever and hypotension. It was towards the end of my shift, and it was one of those days that was non-stop from start to finish. After seeing the patient, the oncologist added an order for diflucan by IV to cover a possible fungal infection. Because that is not kept in the ED, I phoned the pharmacy to send the medication as soon as possible. However, a bottle of Diprivan had been mistakenly labeled in the pharmacy as diflucan and was sent up. Because I also work from time to time in the ICU, I'm familiar with both intravenous diflucan and Diprivan. So when a glass bottle containing an opaque liquid arrived instead of the plastic bag containing a clear solution that I was expecting, I thought that something might be wrong. As I was about to phone the pharmacy for clarification, a physician demanding my immediate assistance with another patient distracted me and pulled me away for about 5 minutes. Not only that, I was being called by another nurse to help with a patient next door. So when I came back into the room of the leukemia patient, I forgot what I had been planning to do before being interrupted and simply hung the medication, connecting the bottle of Diprivan to the patient's line. The patient's IV pumps alarmed less than a minute later due to air in the line. Fortunately, while I was removing the air from the line, I again noticed the unusual appearance of the diflucan and remembered that I had been distracted before I could call the pharmacy. So, I stopped the infusion immediately and sent the bottle back to the pharmacy, which confirmed that Diprivan had been mistakenly dispensed in place of diflucan. Fortunately, the patient experienced no adverse effects. Because of the air in the line, he had not received any of the Diprivan. Now, I consider myself lucky from having the background to recognize the difference in medication. However, I lost track of my own concerns, and the results could have been far worse.